Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today my guest is Dr. Jeremy White of Arc Plastic Surgery in Miami. Dr. White helps men and women feel more comfortable with their appearances and improves their quality of life by helping them breathe better through the nose. He also does a wide variety of cosmetic surgery concerns from head to toe, but especially related to the nose and breasts. Dr. Jeremy is double board certified and is educated at Columbia University, the Albert Einstein College of Medicine, George Washington University, and the Cleveland Clinic. Welcome to the show, Dr. Jeremy White.
Thanks, Neil. It's great to be on today. Thanks for having me.
Well, no problem. Well, let's get right into it. You've talked a little bit about your background and you're very well educated, as I can see. But tell me a little bit more about yourself and who you serve.
So I'm a double board certified plastic surgeon. So what that means is I went through a lot of rigorous training. After medical school, I spent another 5 years doing an ENT and facial plastic surgery residency. And then I spent another 2 years after that doing full body plastic or reconstructive surgery. And even after that, that means that I did some extra work and took some exams, both oral and written. And it's a very rigorous process. So to become a board certified plastic surgeon is, it's not an easy task, but here I am, and I love what I do. And what I really focus on, I like you mentioned before, there are some functional issues and there are some purely cosmetic issues. But in plastic surgery, it's an interesting specialty in that way because a lot of these issues come together, and it's no more. In no other area is that more true than with rhinoplasty, which is one of my particular areas of expertise.
Well, before you go into that, can you tell our audience really what the difference is between maybe plastic surgery and cosmetic surgery? Because people, I think they're pretty much the same thing.
So they are and they aren't. Cosmetic surgery is a part of plastic surgery. This is really the only recognized board for plastic surgery. There are groups of other individuals that call themselves cosmetic surgeons that are not plastic surgeons, and I think this is going on quite a bit around the country, and it can be very confusing for patients because I'll see patients coming into my office for vision work because they were treated by, let's say, a family practice doctor or a urologist, and they were calling themselves cosmetic surgeons. It's a very loosely used term, and really they received no specific training in plastic surgery, but it's kind of a little deceiving. So really one of the things that I'd like to be a take-home point today for our audience is to make sure that they know that they're going to see a board-certified plastic surgeon, because this is really the only recognized board by the American Board of Medical Specialties. And yes, there are also other very qualified subspecialists to take care of cosmetic concerns, such as ophthalmologists who do an oculoplastics fellowship. They do eyelid surgery. ENTs will also do a facial plastic surgery fellowship, and they have a facial plastic surgery specialty as well. But to just call yourself a cosmetic surgeon, there really isn't a board for cosmetic surgery that's really recognized other than by the American Board of Plastic Surgery. So cosmetic surgery, as you would think that within plastic surgery, is the focus on the aesthetics outcome of the surgery. But again, like I said, a lot of these things, it's more intricate than just aesthetic surgery. You have to have a real understanding of what's involved in these procedures, and more so how to handle things when, God forbid, they go wrong. Because no matter how good of a surgeon you are, everyone's going to have, at some point in their career, there's going to be some issue. And that's, I think, really what separates the great surgeons from the good surgeons, and from the, board certified plastic surgeons are most equipped in handling these types of things, are the guys who are not going to shy away when problems arise, or are not going to, who are really going to stick by their patients through thick and thin throughout the whole process.
So, I mean, when we're talking about cosmetic surgery, the whole cosmetic part is great to make you look and feel better, but ultimately it is surgery, and there is risk involved in every surgery, right?
Correct.
So you concentrate mainly on rhinoplasty. Tell me a little bit about the rhinoplasty. What exactly is that? You started to mention this is a real cross between the two.
Yeah, so like I said before, I trained in ENT first, so I have a particular passion for noses. And while I don't do any general ENT anymore, I really just focus on plastic surgery from head to toe. It was a great background to have, because it really allowed me to build a foundation in the skills that are necessary to treat patients with their nasal problems, and to really understand the nasal anatomy. And with the nose, a lot of people who have cosmetic issues also have undiagnosed problems on the inside of the nose. And these are just as important to address with any kind of cosmetic surgery. And I think this is something that's very underserved, or not really looked at by a lot of surgeons. It's very often that I find in my practice that patients will come to me when they've had a previous rhinoplasty surgery, and then that surgeon tried to do a lot with the nose, tried to accomplish a lot, and tried to make it very thin. But the problem became that they stripped the nose of so much structural support, which is really the cartilage, that the patient ended up with a trouble breathing through the nose, and also a pinched appearance to the nose. So I often have to take these patients back for surgery and rebuild the nose for them by putting cartilage back in there, adding structural support, removing some divots, often refining the bridge. So these often go hand in hand. Just, you have to have an understanding of what the nose can take. My approach to rhinoplasty, I always strive to achieve the most natural and beautiful aesthetic results, but everything is within reason, and you have to really, it's one of those things that you can't just put any nose on any individual. The nose is composed of skin, cartilage, and bone. And everyone has a different framework. And so because of that framework, what you can achieve with any given nose is really limited. And not only that, but you have to have an artistic appreciation of what kind of a nose fits with every certain face, because there's the idea of also maintaining adequate proportions between the nose and the rest of the facial features. And this is just as important.
Yeah, it seems very delicate, a delicate, small area that you're dealing with there. So you have to be extremely careful. Now, what took me as interesting was that, most people that probably have a big nose want to, narrow it down and get smaller. But I guess damage can be done to make it too small, kind of like the Michael Jackson nose. But that can be reconstructed again.
That's right, Neil.
Go ahead.
Oh no, that's absolutely right. I mean, that's every patient's worst nightmare, unfortunately, and I've heard that way too often. And so that's a really important thing, is making the patients understand that there are limitations in what should be done. That being said, when I do my rhinoplasties, I'd say 99% of the time it's all endonasal or closed. So there are two different types of approaches to rhinoplasty. There's an open approach and there's a closed approach. And the closed approach means that all the incisions are inside the nose, as opposed to making a scar underneath the nose in the part called the columella. So this has advantages in that not only are you avoiding a scar, But you're also decreasing the amount of swelling postoperatively. You're decreasing the amount of trauma to the nose and the scar that can develop. So I find that, again, the less trauma you do to the nose, the better the outcome is in the long run.
Now, let's get into some of the problems that people have specifically with the nose here. Why do people come and see you? What are 2 or 3 of the main problems that people have with their nose that they want changed?
Well, what they're specifically for the nose, it's dealing with the nasal tip. So sometimes they just feel like the tip is droopy. Sometimes they feel it's just too wide. And then probably the most common thing would be a dorsal hump or a bump on the backside of the nose that they just want shaved down. Now, a lot of patients don't fully understand either that sometimes this bump is actually looks artificially large. And the reason is because their nose even starts too low on their face. So I'll use morphing technology. I'll use morphing software to help show them and help them understand that in that particular situation, it's often helpful to raise a part of the nose at the top of the nose called the radix, or the root of the nose, first, and then shave down a part of the nose in the middle where it's the most prominent bump. But what often is the case is that they don't have as big of a bump as they really think that they do. And it's just about that delicate balance.
Yeah, it really does seem like every face is different, and, you can't pull one nose off of somebody's face and put it onto somebody else. It really has to go. Exactly.
And that's a really big problem. I think it's a big red flag to me when someone comes into the office and brings me some celebrity's nose and says, "This is what I want." And to me, I developed a reputation in the area as being an excellent plastic surgeon, but also as being a very honest plastic surgeon. And I'll tell people straight up front. I'll say, well, no, I can't give you this celebrity's nose, but I can give you a better version of the nose that you have. And let's talk about facial balance. Let's talk about your chin. Is your chin too weak? Because if your chin's very weak, meaning it's too far back, it's going to make your nose look even bigger. So there are other things that we often have to address at the same time as the rhinoplasty to make everything work, to make everything look good.
So what are a couple of the other issues that might not be necessarily cosmetic with the nose that you can help by changing the structure?
Sure. So the most common things, everyone here has heard about a deviated septum. So deviated septums means that the inside of the nose is crooked. And sometimes I have a horrible deviated septum, but it doesn't bother me in my everyday life. So I never got it fixed. But for some people, it gets to the point where their air passages are so tight due to it that you need to straighten it out. So we do this by also internal approach. So a small incision inside the nose, you don't see any scars. And I'll remove parts of cartilage and bone that are offending the airway, that are getting into the airway. There are 2 other components that I address when I'm looking at the functional part. And that's the turbinates, which are these bones that are covered by a blanket of what's called mucosa. It's like a lining. And they can get very inflamed, particularly with people with allergies. And so with this, when they get so big that they're blocking the airway, I'll do a turbinate reduction. And it's sort of like a liposuction of the turbinate. So it's a very minimally invasive, less painful, less crusting approach to the turbinate by sparing the blanket, sparing the covering of the turbinate, going inside and chomping away the bone and then pushing it off to the side. The third part is called nasal valve collapse. And that's something that I will often see either after a patient has been over-resected from a previous rhinoplasty, or some patients who just have a really thin nose or weak cartilage. And when they breathe in, their cartilage or their nostrils will even collapse. I've seen that in patients who have not had surgery before also. So it could just be that they're unlucky and that was what they were born with. But so those are the three most common functional things to deal with the nose.
Well, let's move on a little bit to the rest of the body here. And what other types of patients do you have coming to you? What popular surgeries are they coming for help with?
I'd say the other two most common things that I see in my practice are the mommy makeover and men. Well, let's go into the mommy makeover first. Regarding the mommy makeover, it's a combination between rejuvenation of the breasts and rejuvenation of the abdomen. And what happens is mommy makeovers just means it's a marketing term. It was an idea that came about to let people know that, hey, listen, there are changes that happen to our body after pregnancy. The abdominal wall, the muscles spread apart. And often, at least with the abdominal wall, they're left with a pooch of skin below as well after being stretched out from the pregnancy. So unfortunately, there's really nothing else that will get rid of that other than surgery. And I see this all the time. You'll see these, beautiful skinny girls who come in and they just have they've been said, Doc, I've been dieting, I've been exercising, and I just can't get rid of this. And I tell them, you know what? It's because you were blessed with kids, but you had a little bit of damage to the muscles. So we basically have to do a tummy tuck. And what that involves, it's a low incision. You can hide it in the bikini line, and we remove the excess skin. And it's almost as if we're pulling down a window shade. So I'll lift up the skin, I'll pull down the window shade so that the skin is tight. But doing that alone is often not enough. So what I have to do is repair the abdominal wall, which are the muscles that are going vertically on the belly, and I have to bring those tighter together. And by doing that, I can really take a convex, protruding abdomen and make it pretty flat. I find that when you help patients understand that, hey, listen, yes, this is a trade-off. You're trading a scar for a better abdominal contour, but the scar tends to heal very, very nicely, and you can keep it low when you do right. And when you plan properly, you can really get a nice low scar that's very, very well hidden. Mm-hmm. The other component is with the breast surgery, and while pregnancy is a great natural augmentation to the breast, afterwards there's a bit of disappointment. After a couple of babies, those breasts often will deflate and you'll lose a lot of volume. So some women will come in just because they need to restore volume in the breast, which is usually done with breast implants, and others will need a lift because their nipples and their breasts are just sagging down, also with the volume loss. So sometimes it's one procedure where it's just breast augmentation, sometimes it's a breast lift, and sometimes it's some combination of the two of them.
And for the most
I find that this is just such a great combination of procedures to help women to restore themselves to their pre-pregnancy bodies.
Right. And for the most part, like you said, these women have been going to the gym, they've been working out, they've been dieting, but they just can't get, their ideal body by themselves.
That's right. And it's so frustrating. And when I tell them, I think they often feel much better about themselves afterwards, because I think often a lot of these women feel like they're failing themselves, like they're not doing something right. And it's tough because so many of my moms that come to my practice are very type A personalities. They've done everything right, and they're hardworking, and they have jobs and they have kids. And I mean, what's more of a full-time job than just kids alone? But they want to do everything right. And when I tell them, oh, there's really not much more you can do other than surgery, it's almost like a sigh of relief. Like there's an answer. So it's kind of it's a nice thing for them to know. And I'm not sure that most people know that, there's a big difference between just doing liposuction and doing a tummy tuck. With liposuction, we're removing the fat from the area with these small cannulas and tiny incisions, which is great because it doesn't really leave much in terms of scar. The pain is less, but that will only remove the fat, and it will not get rid of excess skin. It won't get rid of the stretch marks like a tummy tuck does, and it can't repair the abdominal wall muscles. So this is often something that's confusing to very many patients before they come in, and I explain to them what the options are and what one thing will do versus another thing will do.
So one of the misconceptions maybe is, when people think about plastic surgery, they think automatically it's just for women, but you see a lot of men too. What kind of procedures do they come in for?
I do. So it's finally, we're lucky, Neil. We're finally allowed to be vain. And, everyone will talk about their plastic surgeon, and it's normal to have it come up in conversation. So everything is okay, but I'm seeing more and more men in my practice who also understand this. They have very busy schedules, and we do everything we can to accommodate their schedules. And that's one of the things is we really try to do everything we can to minimize their downtime so they can have a really quick recuperation process. So the men that I see in my practice, they're often coming in for things like eyelid surgery or neck lift surgery. We'll do minimally invasive stuff like Botox and fillers on a lunch break. But I would say one of the most common and satisfying procedures for men is gynecomastia surgery. I really feel like I've changed some lives doing this type of a procedure, because I've seen some men who really have spent a lot of their life self-conscious on the beach. We're in Miami, so people walk with their shirt off on the beach. It's normal all the time. It's just that part of the culture. But they felt self-conscious about that all their life. But the people who I really remember the most are men who came and said, I remember there was this one guy who said, I'm afraid to even hug someone because my chest is so sensitive due to these glands that have been developing on the breast. And it's true, you would touch the chest and he was just super sensitive. And when we did the procedure, which included removal of the gland and liposuction of the chest to contour, his symptoms resolved and he was just a super happy guy. He was just more comfortable with himself. He didn't have the pain anymore, and he had a nice flat chest contour. So it was just really a satisfying thing for me and for the patient. Just a really wonderful thing. The last thing I would say is very common for men in our practice is hair transplant surgery. And what we'll do with that is, there was the strip procedure, which is when people used to, or some people still do it. They'll remove a strip of skin and hair off the back of the scalp. And then people dice that up and place those follicles throughout the scalp. But what we do is FUE, and what that means is we're taking every individual follicle out separately, and then we're reimplanting those into our spots where we need it in the scalp. And the big advantage of that is you don't have that scar that develops in the back of the neck. You also have less pain. Yeah, it takes more time, but it really is something that I found that our patients are super satisfied going through, and really helps them regain their confidence.
Now, you've mentioned, especially with the men here, that it's a confidence issue. Let's get into that mental aspect of it right now. And, what are some of these emotional or mental reasons that people come in and are looking for a solution to their problems? Tell me what some of these people are going through and how you're able to help them.
I never promise plastic or basically cosmetic surgery as a cure to any kind of psychological problem or family problem or anything like that. This is not something that I would say, hey, come and get this surgery and you're going to get a better job or you're going to be more successful. Because you know what? That's not true. It's really about you. You should be doing this for yourself. I can think of many reasons, but one thing that comes to my mind, there was a patient who, just the nicest guy, and he came to me because he works in the high-tech environment, in the IT environment, and everyone's really young. And he was saying to me, actually, this was not something that I had really thought about before. He's saying to me that, well, because everyone else around me is so young, and they look at me and they say, oh, I'm old. And if you're old, you're associated with something that perhaps isn't as good in the high-tech IT world. So I found that was kind of a very different reason than what I'm used to hearing, but I found that very interesting as like, hey, he kind of felt like he wanted this for himself, but also perhaps it would be useful in the workplace. Now, I promptly told him that this is not going to help you advance in your career. This is not going to help you do your job better. This is not going to make you more popular. But I did find that background psychology to be quite interesting. I'd say, that with men, I'm just like anyone else, they just want to look younger. They want to, you just want to look younger and feel younger. Often I'd say the most common thing I get is patients come in and they say, you know what? I look like I'm 50, but I feel like I'm 30. I want to look how I feel. And so that's where our conversation starts. So, these are very energetic people. They're really healthy, and you can really make great changes for these people in their lives to regain their confidence. Speaking of confidence, and one other thing that I really address with patients, and something I watch out for, is patients who are severely depressed about their looks. And this is something that I tell patients off the bat, the surgery is not going to improve your mood about yourself. It's not going to make you, if you're an unhappy person and you are depressed, then you need to address that. There's more to it. This is not going to cure your depression. So that's a very common misconception, is that, oh, I just went through this horrible divorce and I'm really depressed, and if I get this, it's going to make me feel better. In that situation, I'm going to tell them, well, no, let's wait. I'm not, let's not operate right now, because I want you to be in a better state before we go through that, because cosmetic surgery is such an emotional roller coaster. Patients, it's really spend a lot of time holding our patients' hands throughout the process, and our staff is fantastic. But I mean, after surgery, for some reason, just people's emotions, they go up, they go down, they're super happy. Maybe a week later, they're in pain and they're thinking, oh my God, why did they go through with this? And a month out, they're like, oh my God, thank God I did this. So, it goes up and down, and that's totally normal. That's just part of the recovery process. So it's normal and acceptable, but it's something that I've seen and I've really understood. And so it's something I prepare my patients for in advance. I tell them, listen, we're going to do this surgery. You're going to look fantastic. You're going to be super happy, but it's going to take you a while, because guess what? You're going to be swollen for a couple of months, and you're not going to look the way that you want to look until that swelling's down, until your scars are healed. But in the end of the day, you're going to be super happy, and you're going to refer all your friends to me just like everyone else does.
Right. Now, one of my favorite books actually is Psycho-Cybernetics by Dr. Maxwell Maltz, who was a plastic surgeon as well. Are you familiar with that one?
I'm not. Can you tell me about it?
It's, I mean, it's very much about what you were just saying, that, he was a plastic surgeon, and where the scalpel could fix many and they would have, they would get their confidence back. It might not have the same effect on somebody else. And basically what he did was he went more into the mental side of it. Just as you were saying, there's definitely a mental, internal as well as an external issue going on here. It's not just the outside of the body that people have problem with. It's often internal as well. So.
Absolutely. And that's the other thing is I spend so much time on my consultations with my patients because I want them to get to know me, but I also want to get to know them in advance very well, because this is not, we're not a place where we just cut and run. We hold your hand throughout the whole process. So, we're going to be getting to know each other quite well. And if there's no rapport up front, if there's no rapport from the beginning of our consultation and during our consultation, then perhaps I'm just not the right surgeon for you. And I'll say that outright to people. If I feel like there's not a sense of trust, or there's some skepticism or something, then maybe you should see another consult, and that's okay. I mean, there are really important things to do before you're, when you're choosing your plastic surgeon. It's just it's not an easy decision always, and sometimes it off the bat. So what I recommend to people is do your homework. Make sure that your plastic surgeon is a board-certified plastic surgeon by the American Board of Plastic Surgery. You can ask about their training. It's also very important. Go on at least, depending on what you're doing, but I always encourage, if you want to get at least 2 consults, because this way you can get 2 different opinions about what it is that you want to achieve. And if your gut feeling, even on that first consult, is fantastic, I'm ready to go, that's fine. But there's nothing wrong with seeking another opinion, because this is your body and you only have one body. The other thing is to look at before and after pictures. Okay, so they ask them about their previous work and what it looks like, because a lot of people can say that they can do things, but when push comes to shove, the proof is in the pudding, basically. So you want to be able to see their photos and see some examples of their work, just like in any other job. And then the other thing is, ask your doctors, ask your friends who they've used, because personal recommendation is always helpful. I find that probably 95% of our patients come from either a happy patient referral or a physician referral.
All right. Well, we were listening to Dr. Jeremy White from ARC Plastic Surgery in Miami. Now, Dr. White, you've covered a lot of ground here and given us a lot of great information and feedback about plastic surgery and cosmetic surgery and all the different procedures that people have. Are there any other questions or objections even that people might have that you would like to address before we go?
No, nothing in particular that comes to my mind. Did you have something else in mind?
I just wondered if there were any objections maybe that some people might have that makes them hesitant about going through with a plastic surgery. Is there anything that comes to mind there?
Oh, well, I mean, when it comes to the surgery, I find that 2 things would be a potential objection, right? It would be, 1, I don't have the time off from work. So that's just something that's a pretty easy fix. You just, you got to schedule appropriately, because for some procedures, they're very minimally invasive. You come in for Botox, you can do it on your lunch break, right? But if you're going for a breast augmentation, you're going to need to take a couple of days off from surgery. And so sometimes it's hard for some patients to schedule it. But, we work with you, and I operate multiple times a week. The other thing I would say is cost. Some patients are, we do accept financing, but not every patient is able to afford cosmetic surgery. we are in a day and age where cosmetic surgery really is for everyone. It's not just for the super wealthy, because there are lots of options in how to pay and how to get financing. But I would warn our listeners that if it sounds too good to be true and it's super cheap, don't do it. Because if it sounds too good to be true, it probably is too good to be true. There's a reason why it's so cheap. We find this a lot in the Miami area. There are so many centers around us that are offering breast augmentation for, $1,000, and you end up in someone's garage and they're putting silicone they're injecting Fix-A-Flat into someone's butt. I mean, there are all kinds of crazy things going on. And the important thing, listen, again, you only have one body. So trust a board certified plastic surgeon, expect to be able to pay for it, because it's not cheap, but it's not so expensive anymore. This is very affordable for most people. The other thing I would warn people about is that because of cost, sometimes you will find that some patients down here, they will travel abroad to get cosmetic surgery. Don't do it. While there are plenty of other good plastic surgeons outside of the country, there are also a lot of bad ones, and their standards of care are not the same. So the problem is that you go to a different country and then everyone is fine until they come back home a week later and you turn into a big problem. And then now you got to search for another plastic surgeon who's going to help you get through it. And I've met a lot of those patients, and they've always wished, oh man, I don't know why I just didn't pay a little more to get it done in the United States, to get it done properly and to have someone take care of me. Because it's not just like getting your oil changed. This is something that's going to be with you for the rest of your life.
Yeah, cheaper always, seems better initially, but it generally never pays off. And
That's
like
right.
you said, you only have one body. Now, I know people in Miami are going to want your contact information, but people do also fly from all over the world to a renowned doctor like yourself. How can they get in touch with you?
You can give us a call at the office. It's 305-501-2000. We're in Aventura, which is North Miami. And our website is www.arcplasticsurgeons.com.
Excellent. Well, Dr. Jeremy White from Arc Plastic Surgery in Miami, thank you very much for being my guest on the show today.
Thanks a lot, Neil. That was fun. Appreciate it.
And to our listeners, if you like what you hear, hit that like button and share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show, or to listen to past episodes, visit businessauthorityradio.com.